Hi, everyone. Welcome to the webinar. Feel free to send us a message in the chat box telling us where you're watching us from. What time is it? Just a brief check-in. Yeah. That's where you're watching us from. And what time is it? Your time. My time is 2 p.m. East African time, and I'm watching you all from Nairobi, Kenya. So do let me know where you're watching us from and what time is it. We're just giving it a few minutes for. Would request everyone, if you aren't speaking, to please mute your microphones. Yeah, so if you aren't speaking, please mute your microphone. In the meantime,
but it's in mute.
If you are not, kindly mute. If you are speaking, kindly mute. It's 4:30 p.m. in India. Thank you so much, Switzerland. 1:02, Philippines, 7 p.m. Oh, Lord. Time zones, am I right or am I right? Zambia, it is 1:02 p.m. Thank you so much. So keep on just checking in, just a brief check-in as we wait for folks to come in. As your participant list is it's slowly coming up. Yeah, so also please do share the link to all our folks and all our friends worldwide so they can be able to join and get to have this amazing discussion. So like, tweet, retweet, TikTok it if you have to. Yeah. So best be sure to send the word out as we get to talk more about self-care. It is 12:02 p.m. in Nigeria. Hi, Francis. And it is 2:02 in Uganda. Thank you so much for all your messages. So feel free to check in. Thank you so much. It is 4 p.m. in Nairobi. I'm also in Nairobi. Right. So thank you so much. We do have 2 minutes before we do get to begin with my co-host, Elena. So just feel free to check in. And yes, I would request if you aren't speaking or on the panel, please mute your microphone so we can give the speakers and the panelists ample time to get to share with us what they have in store and get to have an amazing conversation and get to learn and get to share this information that we have with you today. Yeah. So please mute. Thank you so much to all those who are muting. I see you muting. Thank you. My name is Ruel Okeo. I work with Y Plus Kenya. And yeah, really good to be here, to see everyone. Sure thing. So I'm giving it to my co-host, Elena, to take it away. Elena, welcome.
Thank you very much, Ruel. Welcome, everyone. Thank you. Welcome to our guests. Welcome to our participants. I've seen the different time zone. Thank you very much that you make it. So I think we're just going to dive away. We've got a very, very wonderful session today ahead of us. So we're talking about promoting access to resources on self-care and mental health support. So I think just to start getting into it, just a little bit background about self-care. I think this is a very common word we've been hearing a lot, I think, recently. So self-care, basically, we are talking about actions that an individual take to promote and maintain the sexual and reproductive health. So looking at the empowerment of people to actively make the key decisions about their own health, related to their well-being. It can be access to information, how they can manage effectively their health. So there are a lot of things we're looking into in terms of being in the forefront. We talk about self-love, so this is it. So also World Health Organization recognizes the critical role of self-care intervention in achieving the universal health coverage and promoting health. So in terms of self-care, we've got a project. It's called the Youth-Wise Project, which is being supported by AIDS funds, but at global level is being led by Y Plus Global. So maybe as we're talking a lot about self-care, also just to give you a bit of a background on what Youth-Wise is. So Youth-Wise is a youth-led and women-led project, as already said, initiated by Y Plus Global in collaboration with a network of young people living with HIV. Sorry, if you are not speaking, please mute the mic. All right, thank you. Maybe the host.
Elena, you're muted. Maybe you can unmute.
Oh, okay. All right. Sorry. I think we're talking about Youthwise. So Youthwise is being implemented in 2 countries. That's Malawi and Kenya. At the global level, it's being led by Y Plus Global. That's the global network of young people living with HIV. It started in 2021. So Y Plus Global provides technical support to the country partners that are implementing in the 2 countries. And these partners include the National Association of Young People Living with HIV, that's in Malawi. We've got Coalition of Women Living with HIV, that's also in Malawi. And we've got the Network of Young People Living with HIV, and the Ambassadors of Youth and Adolescent Reproductive Health Program in Kenya. So basically, Youthwise is all about self-care, sexual reproductive health, self-care, advocacy, self-care. So everything is centered and around empowering the young positive to take up the voice and make sure that by end of the day, they are the key responsible people for their own health. So basically, that's more, I think we're gonna also hear about our meetings today. Thank you.
Thank you so much.
Yeah.
I was just giving you a thanks.
Thank you for that, pump up. All right, so I think maybe just to also say, why are we here today? Yes, we've been talking about self-care, maybe in our organizations, maybe in our communities, but the reason why we wanted to come today together and discuss self-care is maybe just to ensure that we are enhancing a great understanding of self-care and the interventions around it. What does it really mean when we say self-care? Those are the answers we want to ask today. And how do we promote access to self-care and mental health resources? Currently, I think mental health has been one of the key issues among young people. So how do we go around promoting mental health and self-care? At the end of the day, also, how do we create a safe space for young people living with HIV to discuss the different gaps, the challenges, and the barriers in accessing health services and overcome them? So today our meeting very much will be centered around responding to that, getting a deeper understanding into that space. So thank you very much, and I think this will be very, very exciting. So looking forward to our sessions. Yes, over to you, Roel.
Thank you so much, Elena. And, that's an amazing intro that you have there. So welcome to all our participants or listeners who are watching us from all over the globe. And, as you're just getting acquainted, it's really nice to meet you. So please use the chat box to let us know your name, your organization, and where you're joining from. So you can also use the chat box and the Q&A function to ask questions or give comments during the conversations. So questions will be collected and answered at the end of the session. So feel free to specify the panelists whom you will be addressing. So here we are going to introduce our panel and get into the conversation. So as we all know, if you have listened to me before, it is I introduce themselves to tell us a little bit more about who they are, do, and then we can jump right into the conversation. So to start us off, I'm not going to be biased, but we're going to start with my hometown. So Rob, if you could please unmute yourself, tell us a little bit more about who you are, where you're from, and then we're going to jump right into the conversation. So Jerome, take it away.
Thank you so much, and thank you for being biased. Hi everyone, I hope you are fine. My name is Jerome Limo. I come from Ruel's hometown. And that is a 254, that's Kenya. And I am so honored to share this space with amazing colleagues. So nice to see you, Elena, Wankumbu, all of you. It's so nice to see you all. I work with and for a youth-led organization called Ambassador for Youth and Adolescent Reproductive Health Program, that is IREP Kenya. And we are honored to be one of the Kenya implementing partners of the YouthWise project. And I'm so glad to be here, and I look forward to sharing amazing insights and information, and looking forward to also learning from the amazing panelists that we have on board today. Thank you, Ruel.
Thank you so much, Jerome, and it's really good to see you. And I need your skincare routine as part of my self-care routine, so thank you. Moving on swiftly, we do have Ishmael. Ishmael stems all the way from Malawi. So Ishmael, could you please unmute and give us a little bit introduction about who you are? Hi, Ishmael. Hey. Okay, so I think while Ishmael is, sorting the technical aspects, we are going to head over to Wankumbu. Wankumbu is a really good friend of mine all the way from Zambia. So Wankumbu, dude, let us know who you are. Okay, I did say where you're from. Give us a brief of Wankumbu.
Okay, thank you so much, Leo. I'm excited to be on this panel with these amazing colleagues of mine, like Jerome has mentioned. So my name is Wankum Simkonda, among my fellow peers, popularly known as Scholar. I work for Pediatric Adolescent Treatment Africa as a field technical advisor for Zambia. So for those of you that are learning of PATA for the first time, PATA is an organization, an action network of frontline health providers that works in partnership with communities and just wanting to provide access to prevention services, optimal treatment, as well as comprehensive centered care that is rights-based, friendly, and stigma-free. So as we discuss, I'll talk more about the work that we do at PATA. Thank you so much.
Thank you so much, Wankumbu, Scholar. Yeah. So moving on swiftly, we do have an amazing set of with us information. Next, Roy, your mic, tell us who you are, where you're from. That would be really great. And once again, folks, if you are speaking, kindly do mute your microphone, and we can have a really conversation.
All right. Hi, everyone. Good evening. I'm coming from the Philippines. My name is Roy Dahil. I'm the executive director of #MentalHealthPH. I'm working on promotion and protection of mental health in the Philippines. Our organization primarily focuses on raising awareness on mental health here in the Philippines using social media and other digital technology. This is my first time to be in this forum, so I'm so excited to meet everyone and learn from my co-panelists. Thank you so much for inviting us here.
You're most welcome, and it's an amazing thing to have you here from India, all the way in India. And it's amazing work that you do, and that the recognition and the work that you do speaks for itself. So thank you so much, Roy, for taking your time and your expertise to be here with us today. And then moving on swiftly, I have a really close dear friend of mine, all the way from wherever they come from, and they're going to let us know because I don't want to give spoilers. I'm not a spoiler person. So we do have Dr. Wole. Dr. Wole, if you could unmute and tell us who you are, where you're from, and then we can jump right into the conversation. Thank you.
Well, I can't wait to jump right into the conversation. Ruel, I'm actually surprised your bias wasn't shifted towards me to start, because I thought we had something going on here, but apparently not. Anyways,
So pick the crowd.
okay, so my name is Wale Wale Ameyan. I am with the World Health Organization in Geneva, Switzerland. My work is on so I'm the focal point on adolescent HIV, but also on voluntary medical male circumcision. So these are two areas that I work on for WHO. I am so delighted to be here, and I cannot wait to to discuss and to learn as well from other speakers. Over.
Awesome. Thank you so much. And I'm going to come and see you soon. I do have Ishmael back in the call. Ishmael, if you are around with us, could you please introduce yourself? Hello, Ishmael.
Yes, lawyer.
Thank you. Awesome. So could you please introduce yourself, tell us who you are, where you're from, and a brief introduction about.
All right, thank you so much. So my name is Ishmael Sbonda Piri. I'm from Malawi, a young person born and living positively with HIV. I'm currently working with the National Association of Young People Living with HIV, Y plus Malawi, as a project officer. So today, I'm one of the panelists actually talking something about the mental health around young people in Malawi context, of course, as well as in Africa. Thank you.
Awesome. Thank you so much. And there you have it. You have listened to the introduction and the names and the works of our panelists today. And you can just get by the nature of the room that the expertise is something that's amazing. And if you are here in the call, please feel free to share the link to your folks so that they can be able to learn and engage from the content that we are about to have. And so we are going to jump right into the conversation. And again, I do have to request, if you aren't speaking, please do mute your microphone to have an easier conversation as we progress. So we have to jump right into the conversation. And before we do that, I do have to say we do have a challenge for you at the end of the call. So please stay tuned for that. It's going to be a huge surprise, which you do not want to miss. So we're going to start us, Ishmael is going to start us off. And Ishmael, if you could be able to just come on board and let us know what are some of the common challenges that hinder access to mental health services.
Thank you so much, Loel. Yeah, I think in Malawian context, I'll talk much of the young people actually living with HIV, and of course the adolescent girls and the young women and the young people who identify themselves as key population. We have a lot of challenges that actually is hindering us in access to mental health services, and one of which we are still talking about stigma and discrimination. As you know that mental health is something associating with you being actually well in terms of mentally, and something that concern your thinking, concern how you address to issues that actually affect your life. So in the communities like young people, when we are socially discussing about issues that affect us, it's actually quite challenging if we talk about our mental health to our peers. And it seems that a lot of young people really doesn't understand what mental health issues are, and we intend to discriminate those that actually come out and speak about their mental health and share their experiences with us, and then that actually intend to affect them mentally and also actually hinder them in terms of access to the services that actually can best work for them in terms of access to mental health services. And of course, in Africa, I think we have low level of knowledge about what mental health is. So lack of awareness and education about mental health is actually one of the issues that also challenge young people in terms of access to mental health services. So limited understanding and mental health issues can lead to delayed or inappropriate seeking of care. So if you don't have much information about what mental health is, even if something that it is actually distracting you, distracting your understanding, and also distracting your mental health, but because you don't understand actually that is a mental health issue, you cannot go and seek for any attention concerning to that. So that's also one of the challenges that is adding to young people not to access the mental health services. And of course, the cost and financial barriers, as you know that in Africa, I'll talk much about Malawi. The young persons are not stable financially. And when actually something intends to distract them, they cannot actually afford to pay for the services, because some of these services, for example, if you want to meet someone who is a psychologist in private hospitals or in private institution, because maybe our government is not able to provide all those in making sure that they are providing these services to young people for free, and because most young people, they don't have anything to do and they are not stable financially, they cannot actually pay for all the costs that can lead them to access the quality mental health services. We can also not talk about mental health without including our cultural and language barrier aspect, because some of the languages, for example, Ishma, I'm working with young people living with HIV in Malawi. But the roots where I'm coming from, I'm actually a Chewa person, and I intend to work in the whole country. At that time, I'm in the southern region where the language, yes, I hope you are able to hear me, Loel, and everyone.
I can still hear you.
All right, okay, thank you so much. So when I'm working in the northern region, and the language there is a barrier, and also the culture, which is different, totally different from where I am coming from. And I meet something that actually distracts with my thinking, and I cannot access the services because I don't understand what their culture is all about, what their language is all about. It can actually limit me as a person to access the services. So the culture and language barrier is also one of the things that distract young people in access to mental health services. And also, as we are all aware that nowadays this is a digital world now. Everyone is accessing information on social media. Everyone in social media in sharing, disseminating, and also creating a lot of contents in whatever that we do as young people. And it's on this social media where one person can actually come, for example, in talking about the health aspect. You are disclosing about your health status, and maybe you are promoting HIV prevention strategies on social media, but someone is using that against you and making sure that they're traumatizing you. They're, for example, trashing negative comments about your health status, yet you came in an honest perspective that I want to disseminate information around HIV so that a lot of young people can go to the facilities, they can get HIV tested, and if they are found HIV positive, they should be put on treatment so that they can suppress their viral load. But someone is coming with their negative attitude, also talking trash to you that, look at Ishmael, is a young person living with HIV, and they intend to do something that we call cyberbullying. That can also affect you mentally. And if that is affecting you mentally, you cannot be able to function and to think properly that you should seek for something. For example, you should meet a counselor, they should counsel you, and to make sure that they are seizing the situation. So cyberbullying is also one of the aspects that young people are highly affected in terms of mental health, and it intends not to allow them to access mental health services. So we can talk about a lot of issues, but all these aspects that I've spoken about, the culture and language, the social media, cyberbullying, the geographic and transportation, cost and financial barriers, stigma and discrimination, and also lack of awareness and education is what is really affecting young people not to access the mental health services in as far as Malawi as a context and also in Africa, because I'm saying this, I've been interacting with a lot of young people across the borders, young people in Zambia, young people in Zimbabwe, young people in South Africa, in Eswatini, in Kenya, in Tanzania. But it seems one of the issues that young people are actually talking about that are really cross-cutting issues that we can conclude that Africa is actually facing same issues in as far as promotion of seeking to the mental health services is concerned, Luel.
Thank you so much, Ishmael, for that. And, you know, I would have to speak about that a little bit by saying the things you have talked about, I have experienced as a person who's publicly living with HIV and talking about it, especially cyberbullying. And that's true that it does get to someone's mental health, you know, and it can hinder someone from accessing said mental health services. And, you know, because you've brought that out really well, and, you know, you've also tackled the aspect of stigma and discrimination, you know, I would now love to shift the conversation a little bit to Nkumbu, where he can come in and now tell us how best we can address stigma and improve awareness about self-care. Because just following up on your question and get to hear an experience from all the way in Zambia and how best you can be able to do it and how Zambia is also doing it would be amazing. So Nkumbu, would you come in with that?
Okay, thank you so much, Luel and Ishmael, for being extensively elaborate in discussing some of the challenges. And like you've mentioned, these challenges are cross-cutting. I'll quickly give an example before I go to some of the issues that are addressed here. Recently, we had a training where we are conducting a mental health training for some student learners. And I was asked this question by one of the participants to say, how do you help someone who's not showing signs of being depressed or having some mental illness? How then do you help them? And this young person who asked me this question recently, in the last 3 months, lost a friend who they were sharing a room on campus. And after that, another person shared a story of how they have tried to commit suicide, but fortunately, this person has not died, and we thank God for that. So what I'm trying to say is that if you sit in a room of 10, 20 young people and you hear of an incidence of someone having committed suicide as a result of depression, another one almost committing suicide twice, it really tells you how extensive the issues of mental health are, especially amongst adolescents and young people. And these are becoming a challenge because there is lack of knowledge and awareness on how to identify some of the signs so that we are able to offer psychosocial support to some of our friends that are being depressed or that are facing all these mental health issues. So when we identify stigma and discrimination, lack of knowledge, what we need to then look at is the fact that mental health is something that needs a lot of investment. And this investment should cater or try to address the lack of knowledge. And for us to do this, we then need to capacity build peer supporters. We need to educate them so that they go out there to share knowledge with other young people that may need this support. So lack of knowledge really is one of the challenges. And when we are trying to link this to self-care, which I know to some people joining us on this call that are watching may hear self-care and think of it as something new. Self-care has been in existence. The World Health Organization has created guidelines, okay? And when you look at these guidelines, one of the examples of self-care is self-awareness. Self-awareness entails what Ishmael was speaking about, getting information from digital platforms, getting information from IEC materials, and even this investment in mental health that I'm talking about relates to the fact that there should be resources that are made available to manage these digital platforms, as well as to produce and distribute IEC materials. Because in our African settings, the internet penetration in most of our locality is low. And even some of the young people do not have digital phones that they're able to access content online. And that's why, even in this 21st century, I really emphasize on the fact that we need, if we are to address some of these issues or stigma around mental health and HIV, we really need to invest in IEC materials so that there is knowledge out there. People are able to equip themselves with information. If you equip yourself with information, you are going to make informed decisions. And other than that, we need also to look at a number of issues, okay? And the other thing, maybe before, as I conclude and before I end, is that we need to really advocate for more resources in mental health. I've spoken about the IEC materials, but also encouraging young people to seek help whenever they feel that they are alone. Self-stigma is one of the biggest challenges. Before we look outside, we do stigmatize ourselves and fail to seek help. And this is the more reason that I'm saying, let's equip ourselves, let's love ourselves, let's have that self-care to seek for knowledge, to be aware of the information available, and also to be aware of the people that we can seek help from. Well, I should know that this problem that I have, I should be able to come to you, or maybe this problem that I have, I should be able to go to Elena. Nowadays, because of WhatsApp, you say a problem shared is a problem exposed. But now I want to tell the people or the friends that are on this call that a problem shared with the right person is the problem solved. So for us to address stigma in mental health and HIV, we need to share our problems with the right persons so that those problems are solved. Thank you so much.
Thank you so much for I do appreciate what you talked about, financing when it comes down to, addressing stigma and improving awareness about, self-care. And, that is an amazing input. If I have it, I'm going so I definitely will not. And if we're moving on swiftly, if you're just joining the conversation, thank you so much and welcome to today's webinar. So please do check it. Let us know where you're watching us from. Do share your name, what time is this where you're watching us from, and something you feel you need to share. Do use the Q&A chatbot to be able to ask your questions and your answers, which will be addressed at the end of the call, as well as we have something special for you at the end of the call, so stay tuned for that. And now that we've listened to our young people talking about the conversation around self-care, we now want to hear from the YouthWise implementing partner. And we have already established from the beginning of the conversation that, YouthWise is a huge project that's tackling, around mental health, self-care, and Y Plus Kenya. Sorry, I love Y Plus Kenya so much. Y Plus Global, Y Plus Malawi as well. So we're going back to our representative or on the YouthWise implementing partner, Jerop. So Jerop, if you could come in and do let us know what collaborative efforts can bridge the gap between self-care and mental health services.
Thank you so much, Ruel. And I really do love the discussion from Ishmael and Wankumbu. They've kind of set the pace, and I'll just pick up from what they mentioned. Ideally, in the context of the YouthWise project, a lot of the effort has been around to ensure more young people understand, realize what the self-care concept is. Please mute your mic. Okay. So ideally, the efforts we've been making for the last 2 years has been to ensure that as many young people living with and affected by HIV and in their diversities have a better understanding of the concept self-care. You know, a lot of times when you talk about self-care, we think about, you know, doing our hair, going to the nail parlor and things like that. But there's a health self-care where we take care of ourselves health-wise. You know, there's the body-wise, but now we are dealing with our health as young people. And I do love the concept of self-care because it is definitely putting the power in my hands for me as a young person to be able to make informed choices about my health, about my reproductive health, about my adherence and my treatment, and just giving me the empowerment and the knowledge that I need to be able to utilize and to use to make these informed choices. And when I think about the efforts we've made, I think about the many engagements we've had with young people, the many conversations we've had with stakeholders, you know, in country, regionally, as youth-wise partners, but also really the advocacy we are trying to push for the embracing of self-care as a tool, as a concept that really, really young people are open to and are excited about. But also, how do we make sure that self-care is possible? I mean, it's one thing to tell me to access services, to, you know, take my medicine every day, but it's another to actually be able to access this medicine, to be able to access these services, to be able to access all these things. So ideally, one of the most important thing and collaborations that we're trying to do is to push our healthcare governments, both in Kenya and Malawi, to make sure that they understand the importance of availing services and commodities for young people. We are doing a lot of demand creation, but the uptake is not balancing because the demand is there, but the products that are supposed to meet the need are not there. So one of the major efforts we've been trying to do is advocacy around ensuring that our governments are able to allocate resources to ensure that healthcare services are available. And, you know, we say not just healthcare services, quality healthcare services, comprehensive healthcare services, services that are tailored to meet the needs of adolescents and young people in their diversities. And for us is to see the concept of self-care being embraced all over the world by our governments. I think the best thing about self-care in Kenya is that it has been approved. We do have a whole self-care guideline in Kenya. So ideally, we are trying to push that even more African countries will be able to embrace the self-care concept, that even in our guidelines, be it in the reproductive health guidelines, in the HIV guidelines, that we'll be able to talk about self-care more, because then we are not just supporting the young people, but we're also really unburdening the health system. And for us in the African setup, we know how our healthcare systems are. They're really not the best. But imagine when you empower a young person and they have the ability and the capability to be able to partake healthcare services without even the support of a healthcare giver. I mean, they are very empowered. They know what to do. They know when to take their medication, and they're on the right track and they have access to support. That's very, very important. When I think about self-care and mental health in relation to the efforts we've been making as youth-wise partners, is to really tie these two together. I liked what Firi and Wankumbu mentioned, that, you know, mental health is something we're still trying to understand. It's something we're trying to be open to talk about and to really ensure that young people are able to access mental health services. For us as youth-wise partners, it has been very paramount to ensure that these services are made available, particularly for mental health. We all know how expensive these services are. Therapy, psychotherapy, all these things are not affordable. And unfortunately, they're not free everywhere. And even so unfortunate is that it's not a conversation that adolescent boys and young men like to talk about, for example, when I think about mental health. So for us is to really relate self-care to SRHR, to HIV, but also really to mental health, so that as we're empowering young people, then we are holistically empowering them around these key areas, and really reminding them that self-care is also taking care of your health, of your mental health, of your physical health, of your, of your treatment journey, and generally the wellness of you as an individual. So for us, I'd really tie our collaborative efforts towards the advocacy that we've been doing, and to really push for the self-care agenda to be known to many more young people, but also for governments to embrace it as a concept that actually works. You're on mute, Ruel.
Okay. Ish, man, thank you. I was saying thank you so much for that extensive, answer to the question. And again, I do realize we're going back to the same thing, financing health in regards to mental health. And so while we're at it, because you have brought out the collaborative effort really well. So how can implementing partners support youth in now accessing said mental health resources? Okay, so now it's not about collaborative efforts in bridging gaps, it's about how we can access the resources.
Ideally, I would really tie that to working, one, with the governments. I think as organizations and implementing partners, when we sit down to think about the YouthWise project, we think about sustainability, that what happens when YouthWise is no longer a project? Does the self-care concept die down, or will it continue, and will it be more embraced, and that young people will be able to practice the self-care concept even after the project? So for us is to really collaborate with the government. We all know that the Ministry of Health in our variety of countries are such important stakeholders in this response. So really ensuring that they are able to see, what is this self-care concept? What has it contributed to? Are there changes attributed to teaching young people about self-care? And why is it important for them as the government to not only really allocate resources towards supporting continuation or even upscale of self-care projects, but also really embrace self-care as a concept in itself. In our countries, self-care is a concept that is still new, and we're still trying to ensure that people understand what this self-care is about. But the most important thing we're trying to make sure is that the government actually thinks about its entirety as a concept. I mean, I would be so happy that after the YouthWise project is over, to hear the county government of Nairobi, for example, where we implement YouthWise, still calling us upon to say, we want to teach young people about self-care. We want to include self-care in the concept. We want to implement the self-care guideline, for example. For me, when I think about resources, that's how I look at it. The other thing is to be able to access more resources as implementing partners to upscale the work. We've only just dropped a fish in an ocean, and there's need to do much more. And I know my fellow implementing partners would agree. The demand is there. So many people want to interact with the YouthWise project. So many young people need to learn and be taught about self-care. But of course, there's always the limiting factor of, not enough resources. So access to resources to be able to scale up the self-care concept is quite important. But also bringing the self-care concept in rooms where we have other development partners, other partners who can be able to support really scaling up this concept even beyond the countries where we implement the YouthWise project. And I think that has a lot to do with advocacy. That has a lot to do with WHO keeping on removing guidelines and instructions, because they are the ones we really do follow and look up to when it comes to guidelines and policies around issues of self-care. So ideally, I would tie down to governments really allocating resources to fund and support these services, SRHR, mental health, and we tie it down with self-care, and implementing partners being able to access resources to scale up the work that we've done for the last 2 years, and really also saying and mentioning and talking about the self-care concept in rooms where it's not a topic, it's not a discussion, and people are still not able to understand what we actually mean when we talk about self-care in relation to SRHR, HIV, and mental health.
Thank you so much. Rather speaking on the panel. Thank you so much. And before we continue, or supporting mental health services. Thank you so much for everyone who's checking in on the chat box. I do see a question here. Question is directed to Wankumbu. Wankumbu, your question, the question is, my question goes to Wankumbu Sikumonda. Since he spoke on the aspect of subduing of a mental health problem, so question, what do I do if the support doesn't help? So thank you so much, and please hold on to that. We are going to have a Q&A session at the end of the call because of time. So we are going to proceed swiftly, and I'm going to allow Elena to come in and take over and carry on with the next set of the panel.
Thank you very much, Raul. And we're having a very wonderful discussion from our panelists. I know I'm learning a lot, great insights. I think we've looked at the challenges. We've also looked at the interventions that are currently in play, where in terms of youth-wise, as we heard from Jerome. So moving forward with our discussion, so I think just looking more at evidence-based self-care practices, just to learn more in terms of global mental health. So my question, I'd like to hear from Roy. Which evidence-based self-care interventions have proven effective for mental health? Over to you, Roy.
Thank you so much, Alina. So just a quick definition. As earlier defined, define self-care as actions done by an individual to promote health, prevent diseases, maintain health, and to cope with certain illnesses and disabilities with or without support of healthcare worker. In the lens of mental health, there are several self-care activities that are proven to be effective in improving mental well-being. I think lately buzzwords, especially in social media, we've been hearing there are a lot of activities that focuses on mindfulness, different breathing exercises, and also they somehow it also correlates like different physical activities, how these physical activities also affects or improves our mental health. Different journaling activities where we can document, or we can dump all the thoughts that we have, all our worries, and all our whatever we're feeling. There are also several mobile applications nowadays focusing on mental health, and there are also use of different mental health workbooks, where especially I think for young people, it's important for them, or it's helpful for them to be able to interact with an activity with like prompts, or document and organize their thoughts. Just to share during the COVID, there are several workbooks developed to help people handle difficult situations during the pandemic. In the Philippines, for example, our organization, in partnership of our Ministry of Health, we developed and distributed self-care kits for Filipinos. Workbooks, according to literatures, have various uses for healthcare providers, especially for young persons. Self-care kits that we developed, it contains several worksheets, helpful tips, different psychoeducation approaches that can be done even outside mental health sessions with or without support of healthcare workers. This kit that we developed was co-developed with young people, persons with lived experiences, mental health advocates, and professionals trying to address mental health challenges and experiences during the pandemic. And during the co-development of the kit, we tried to understand the different barriers why young professionals, why youth, find it difficult to seek help and take care of themselves, and try to tackle it in the language that is compassionate, easily understandable, and actionable for the young people. And maybe for our implementation sites, I think an important point that I want to drive across is whenever we want to implement certain interventions in terms of self-care, in terms of different kinds of activities, we have to make sure that the persons that our target audience are involved, and that we have to make it as easily understandable and actionable for them, and focusing also not only on helping themselves, but able to bridge them to appropriate support whenever they need, or should they be needing it already.
All right. Thank you very much, Roy. I'm very interested, and I like that you also talked about co-creation, there whereby you involving different kind of key targets, the young people, the advocates, in terms of coming up with solutions. And you also talked about the development of applications on mental health. I think when we're talking about young people, we're looking at a generation that is digitally active.
Yeah.
So, not talking about digital, how can digital tools and apps support self-care in this context as you're explaining?
Mhm. Yeah, so currently there are several applications that have been released for like for example tracking moods, for reflection where you can document your thoughts, or mental health applications that focuses on helping you focus or helping you organize your activities. There are some applications that go as far as linking you to professional help. So it means that when in the at the comfort of your home, at the comfort of your community, you can reach out remotely to a health professional, or sometimes there are also mobile applications that links you to certain support groups where you can receive appropriate support. In the Philippines, for example, the Department of Health, our Ministry of Health, released the first mobile application for mental health, with as of date have 17,000 users or downloads. Um, this application was used or can be used by service users to document their mood, access mental health resources and infographics that are tailored fit to Filipinos, and also link them to certain directories to service providers. Mobile application, since it's very mobile, can be very useful and accessible. We can also make it dynamic and or fun way of introducing self-care or fun way of introducing mental health, and a more interactive fun way for the youth, like for example making it gamified version, or like using user-friendly interfaces. In some countries where digital applications are accessible, leveraging digital solutions for interventions for are beneficial. But we just have to take a note, or for us to also be mindful that in some countries where phones are not that accessible, introducing digital technologies could actually further the divide in accessing services. So digital technology, yes, may be able to democratize healthcare services, but it can also further exclude people who are unable to access these platforms. It's very important for us to involve the youth. What are the current and status quo interventions that we, as status quo resources that we can implement, so that our interventions are tailored fit and not could further divide the service users to the services. All right.
All right, thank you very much. I think it's really important to also create reference, especially when we're talking about mental health, and also the ability to categorize the different key targets around self-care and mental health, like looking in terms of the urban, the rural, in terms of what kind of tools can you use for the different populations. Thank you very much, Loy. So moving forward, I think let's take it up to World Health Organization. I think to understand it up at a different level. So going to war, just to learn from you, how does the World Health Organization prioritize mental health within its global health agenda?
Yes, thank you, Elena, for that question. Perhaps let me just start by acknowledging those that have spoken already. I think a lot of what they have said actually resonates with my thinking, but also in the work that we do at the World Health Organization. So like you know, the work of the WHO is really to speak to what one of the speakers, I think it was Jerome or Wakombu, who was talking about the central role of the ministries of health and program managers in making sure that all of the things that we're talking about becomes policy, and we can, support, health workers or service delivery persons to put forward these services. So perhaps the first thing I would mention is the need to make sure that we are talking and convening and speaking about it. So like we have all of the people who are speaking here, you have so many people listening and putting forth these ideas. That is actually how it starts, for WHO. we don't just make guidelines just for the sake of it. We actually listen to what all of you are saying and say, okay, it seems like this is a really important message. This is a big gap, and we need to then put forward mechanisms for which we can then begin to develop guidelines and recommendations to fill them. So I think that's the first thing I want to say. I want to make that pitch to all of you, the conveners, so Rele, Elena, and all of the panelists, to say that the work that you are doing to convene and to make sure that these topics are being spoken about and being advocated on is really, really key, so that we can understand the pulse of what people are saying and what people are wanting us to act on. So I think that's the first thing. The second thing is that, and again, this was sort of touched on perhaps by Ishmael, that for a long time, mental health was seen as an adult thing, but we know that that is not correct. Mental health is absolutely not just an adult thing. We have seen from data that even amongst older people who have mental health conditions, more than 75% of them would have started by the time that they were 15, going towards 20, up until 24. So I think that's a really important message that we need to understand, and we need to continue to speak and push this idea forward, that mental health is not just for adults, it's for all people, but particularly young people and adolescents, because like we know, adolescents and young people go through that stage of development that you cannot find at any age of the life course. So for WHO, we now have a separate work stream of adolescent mental health. I mean, that tells you what priority and focus that we have on it. Some of you on the call may be aware that we now have the adolescent mental health guidelines, which is a specific guidelines and recommendations on adolescents and mental health. You would see in those that piece of work that we now have very specific evidence generation, but also evidence implementation on what we need to do as regards protecting, but also maybe protecting is a bit top down. I think it's more supporting mental health for adolescents and for young people. Perhaps the third thing, just to mention as well, is that the focus on health has to shift, and that is another priority that we have at WHO that I can speak about. It is no longer just about health; it is about well-being. So as we talk about mental health, it is about the overall mental well-being, and this is something I can share maybe after the call as well. We have, of course, the adolescent mental health and well-being framework. So this actually speaks to 6 pillars and domains. Roy and Ishmael spoke to some of them. When we speak about stigma and connectedness, resilience, the fact that young people, many are not employed and do not have the financial independence to deal with what life throws at them. So these are the different dimensions of the well-being framework that WHO is now beginning to promote. Actually, just yesterday at the World Health Assembly, this framework was launched, which I'm hoping that as we take it forward with program managers and ministries of health, we can begin to promote this health and well-being, overall well-being sort of thinking. Finally, is about access. It doesn't matter whatever we do, if we don't have access to these services, then it makes no difference. So access is about demystifying mental health, right? We have to now move and shift from having mental health just for the so-called having mental health for the so-called specialists, but moving towards non-specialist self management of things that we can work on. So I think these are the 4 aspects, perhaps 5, that I would say shows the high level priority that we at WHO have for mental health, but also mental well-being.
All right. Thank you very much. I think there's a lot of comprehensive information you've shared. And I think by the end of the day, we talk about doing advocacy that is evidence-based, and that's what you are telling us right now. And I'm glad that we already have these guidelines in place, the adolescent mental health guideline and the framework. I think this is what young people can use as a mantle as we're advocating in our countries. So still very much interested on the guidelines in terms of the perspective you have given us, and we're interested to know World Health Organization has repackaged these guidelines, but just also understand how has it promoted positive outcomes for the mental health.
Yeah, so that's an interesting question, and you know, in responding to that question, I think you know, I actually in the last few days looked back at those repackaged guidelines, like you put it, and I think you're right. It's you know, leaning on to what one of the speakers said. Some of these concepts, right? They're not necessarily new, right? It is more about how we repackage it, how we put it together in a way that speaks to young people and in a way that speaks to countries. A lot of the discussions that we speak about innovation, you know, for instance, you know, people say innovation, it doesn't have to be something that is you know, happening for the first time or something new. It could actually be doing old things in a new way, right? That is part of innovation. And one of the ways that these guidelines have really repackaged and innovated is by seeking the perhaps the bi-directional linkage, you know, that linkage between self-care and mental health. In past editions, it was more vertical. So we're speaking self-care, we're speaking mental health on the other hand. But I think what these guidelines do is that it links it together in a way that is holistic and in a way that makes sense, you know, to young people and to, but very importantly as well to policymakers. The second thing that, you know, to mention is, you know, the generation of evidence. I think most of the speakers they mentioned the fact that, you know, in the past, and for those who work on research, it can be quite difficult, you know, honestly, to bring together evidence, synthesize them, move them from evidence to recommendations. It can be quite a long, you know, lengthy, laborious process. But I think what this guidelines has done is that been able to bring together that evidence in a really good, nice, people-friendly way to bring forth, you know, over 40 recommendations. And many of them are things that, you know, again, they've been there before, but they've just not been packaged in a way that that makes sense. Perhaps one more thing is speaking to, you know, the meaningful engagement, which some speakers also already mentioned. So what we had always thought about was the meaningful engagement of young people, you know, for instance, meaningful engagement of adolescents. But we sort of neglected the meaningful engagement of self, right? And that is where it really starts from. And I would say that with these guidelines, we begin to expand that conversation, not just to the meaningful engagement of different stakeholders. It's now about, as well, the meaningful engagement of self. And when there is meaningful engagement of self, then you can expand to meaningful engagement communities, of young people, of health workers, and so on and so forth. So it's that repackaged meaning of engaging self, but also understanding that an engagement of self is an engagement of mental health, is an engagement of well-being, and is an engagement of the whole of society as well.
All right, thank you very much. I think also one of the key issues, I think among young people, I think in different countries is we've got guidelines, we've got policies, but sometimes it's difficult to understand and sometimes they're not localized. So I'm glad that you really explained in terms of the packaging very well. So still on to you one more last time. So you've given us the resources, because I know guidelines, the formation, this is a powerful resource for us uptake. But what other resources does the World Health Organization offer to promote mental health?
No, really, I take your point on the need to to soften our guidelines and make it a bit people friendly. So I have to say, on that, just two things to mention. The first is that there is now some very serious discussions within, certainly the HIV, hepatitis, and STIs department where I work in WHO, to make sure that the length of our guidelines is sort of reduced. Nobody wants to read, a 500-page document or a 1,000-page document. I think there is now, first of all, a push to make sure that we have shorter and briefer documents and guidelines. I think that's one. The second thing is that, and this goes as well with the self-care guidelines, is that these have now been made what we call living guidelines. So living because, in the past we would have a guideline today, and then in 3-4 years' time, we have to go back and start that process again. So with this living guideline concept, we can, update the recommendations, update the evidence iteratively as they come. So we don't have to wait 3-4 years to come back. I think that's a really key thing, to mention for colleagues and participants on the call. The third thing is as well, maybe people will be interested in, the app for the guideline as well. There is a magic app now that sort of coalesces all of the different resources and tools on self-care and mental health in one solid app. So perhaps this is something that we can share. We can continue to see how we develop and make it holistic. Perhaps to mention as well that we have now training materials that are differentiated, to different audiences on how we can cascade these recommendations and guidelines for people to use.
All right, thank you very much. Thank you for sharing all that information. And I believe the young people attending the meeting, you've heard in terms of the available resources like the training, like I hope we can get access to that and keep learning. So thank you very much, everyone. I know there have been questions in the chat box. Keep them coming. Ruel will facilitate that at the end. So at this juncture, I give it back to you, Ruel. Thank you.
Thank you so much. And thank you so much, Dr. Wole, for that amazing conversation. I'm really looking forward to having the documents and going through what it says and how best it can be able to impact my community back home in Kenya. So, folks, we do have the time where we get the Q&A session. And so all the questions that you have been having, or you've been feeling, that pressing thing that you have, do let us know about it in the comment section. So here we are. We did have one question that was from Cosmos. I'm really trying to find it. Oh, yes. So I have found it, and the first question goes out to Wankumbu. Remember, guys, folks, this is a 10-minute session because we are almost coming to the end of our conversation. So we're going to keep our Q's and A's very brief, because I have a surprise for you at the end of the call, so stay tuned. So Nkumbu, the first question goes to you, and the question is, you spoke about the aspect of subduing of mental health problems. Now the question is, what do I do if the support doesn't help?
Well, thank you so much, Cosmas, for that interesting question. And like I said, that, you know, these problems that we have sometimes, mental health issues, anxieties, depression, we may need to find the right person who we can share this problem with. But as it is always is, sometimes when you are trying to find a problem to something, that person may not be able to help. But this is the more reason then why we are talking about self-care. So if we learn to practice self-care, we are going to identify habits or activities that are going to help us and promote our own well-being. We have heard from World Health Organization that when we talk about self-care, we are really trying to talk about an individual's well-being. So really, in terms of promoting self-care or seeking help, we need to practice self-care as an individual and engage yourself in activities that are going to promote your well-being. So for instance, I can give an example to say, sometimes if I'm feeling a little bit low, I wouldn't want to listen to, for instance, gospel music, because I'll feel worse. Yeah, there are some people whose spirits are going to be lifted if they listen to gospel, if they listen to kwaito house music. So we need to identify some of those things. Are you going to meditate? Are you going to take a walk? Are you going to exercise? So I think that's how, if you feel to find help elsewhere, find it within yourself. And this is at the center of self-care. Self-awareness is part and at the center of self-care. But maybe lastly, I would want to say that on this platform where we have World Health Organization and other key stakeholders that we are working with, we are saying that our health providers in these communities and facilities, they need their capacities to be built so that they can offer professional mental health services. Because if our health providers are not equipped or capacitated with the right information, then their support is limited and mental health is complex. So let's look out and ensure that our health providers are capacitated for them to help to offer professional mental health services. Thank you so much.
Thank you so much, Nkumbu. And I am getting some of the comments in the comment section. Well, someone has suggested listen to music while you're... That doesn't help the situation, friends. You know, that is not what Nkumbu meant, okay? You can't listen to sad music when you're sad, all right? Look for uplifting sort of music. And we also do have another suggestion. So please, we do have a few minutes before we end the Q&A session. So if you do have a question, do drop it in the chat box. So we do have a suggestion here where Lubinda says mental health advocacy must be taken to parents because parents are the first teachers we have, and them being aware of these mental health issues can really reduce the problems. Normalizing these conversations in homes will be very, very helpful, and it has received quite some of the reactions. We do have 4 thumbs up, 6 hearts, 1 thumbs up, and 1 celebration. We also have Sbongile has agreed by stating, I agree with you, parents or guardians are our first teachers. So if mental health conversations can be normalized, it would be a lot easier for young people, even as they leave their homes, to ask for help and other peers. So those are some of the suggestions that have been put in the chat box. And Swongile also has stated, I agree with Nkumbu, as he has earlier mentioned, that truly sharing a problem with the right person is effective, I feel that it protects my judgment or ridicule that comes with sharing sharing with everyone. We do also have Gloria talking about the mental health starts with self-care, self-love, self-acceptance, and choosing to live a positive life. Thank you so much, Gloria. And Jerome, we do have a question for you before Ishmael comes in. Jerome, my question is, how do we keep to sustain mental health programs running after a project ends? And how do we engage young people who seem right mentally, but deeply having mental problems, and promote self-care to vulnerable youth and adolescents in rural settings where there is limited access to services? So Jerome, take it away. Hi, Jerome.
Hi, Ruel. So ideally, I think one of the most important thing would be to, first of all, I really do like the concept of wankumbu, sad music when you're feeling sad, or going for a walk. I think that's very, very important. And I do like the conversations on the chat. One thing I would want to mention is that as the Youthwise partners, we've been very keen to not only empower the young people, but also empower the environment that surrounds young people. And for us, that includes the parents, the caregivers, the teachers, religious leaders, community leaders, because one thing we recognize is if a parent does not understand what mental health or mental well-being, like Wale mentioned, is, then if I say I'm stressed, my African mother will ask me what a child is stressed about, literally, right? And it's because these are not conversations we're open to. So for me, it is that we have a huge, huge mandate that goes beyond the adolescent themselves or the young person themselves, also to the environment that surrounds that young person, the mother, the father, the auntie, the grandparents, the teacher, because it's a mandate, and we want to not only just empower this young person, but we want to create an enabling environment where they can be able to practice and make use of the information and the knowledge and skills that we give them. So how I look at it, for me, it's beginning with the young person, but also prioritizing the spheres of influence surrounding this individual.
Thank you so much, Gerald, for that. I really hope that the question was answered effectively. And we're just going to take one last question, and then Ishmael can come in. We take one last question, and then we're going to close the Q&A session because I see our time has heavily gone. Sorry, Maria. Ishmael, go ahead.
All right. Thank you so much, Loel, for giving me the opportunity to speak once more. I also just wanted to respond to that a comment that said we should actually take the mental health issues into the families. But much as we all agree with that, because we understand that the parents and also the guardians knows us as children much better than the community and the society can know us, and it's actually where the conversations around mental health they can actually start from, and to make sure that our young people in these families are actually comfortable with whatever that can come across them. But we should also understand that in some families, in other scenarios, is actually where the mental health problems actually is being promoted in, and also the issues is actually coming from. So as oneself, as we are talking about self-care, and as I've also mentioned, one of the factors that actually leads to the a limitation about access of mental health services, I talked about the lack of awareness that individually we should understand what is it as we are talking about mental health, what are the factors that causes mental health, so that if you are actually facing that issues in the families, you can actually already understand that this is a mental health issue and I have to seek for the service so that I can actually be well. I cannot be depressed. I cannot actually start having the anxiety and a lot of things that can come after that. So I just wanted to agree with that person, and also to make sure that it is very crucial for oneself to understand that these are actually the issues that can cause mental health problems. So if they're actually starting in the families, and it's actually your parents, your guardians that are fuel gas, I can say gas firing the issues around mental health, you can already know and start to seek of the services that can make you to feel comfortable about that situation. Yes. Thank you.
Thank you so much, Ishmael, for that. And to our last question of the Q&A before I come with my gift or surprise is my question goes to any of the panelists. So I would want Dr. Wale can tackle this. All right. My question goes to any of the panelists.
Which one is that?
Most of the times we mistake mental health issues with spiritual issues, especially here in Africa. So how do you differentiate a mental health problem from a spiritual problem?
Well, I think it's a loaded question, and perhaps what I would say to that is I'll probably just link it to what Kubu mentioned, which is, we need greater awareness, knowledge, and information about mental health, because without that, then we begin to be in this zone where we are in what I'll call mental health denialism, right? Where we're seeing what's going on, but we are in denial, and oftentimes, a lot of these issues, they require very prompt and quick management. And when we don't do that and we label it as something different, then we're not, I don't think we're serving the person well, and we're not serving communities well as well. Perhaps the second thing is just also to make sure that we, and I think I mentioned this, demystifying and removing all of the myths as well that we know occurs in many of our societies regarding mental health. I think some has to do with stigma, discrimination as well. I think we need to make sure that we tackle this. And then perhaps finally, to just echo what Ishmael said on providing, making sure that we have different outlets for providing support. Sometimes, and we've seen this from evidence as well, what someone needs, might be a lot of, they're faith-based, talking about the spiritual, they're faith-based examples of how, you can go into faith-based institutions, and that can sort of help mentally. There's a lot of evidence on that as well, but it's not just one versus the other. It's about having different, different modalities, and making sure that whatever we do, we always follow the evidence, and making sure that we do things in an evidence-based way, and in an evidence-informed way. Equating mental health with spiritual attack, I'm not sure is always very helpful. I think we need a sort of whole of society support for people to be able to access evidence-based services and interventions.
Thank you so much for that. And I do hope that person who asked it, the question has been answered to your satisfaction. And so with that, allow me to close the Q&A session. Thank you so much for your questions, for your answers and suggestions. And so now we have arrived at the time where I give you the goodies, okay? Here is where, although, sitting here for the past hour and a half has been an amazing session, and I just can't let you leave like that. So we're going to go back to the host at Y+ Global to share the slides that we have. I have something amazing for all of us in the conversation today. Well, okay, maybe for 18 to 30-year-olds, I'm really sorry. I don't make the rules. Here we were talking about, promoting access to resources on self-care and mental health support. And these have been our amazing panelists, me, yours truly, Lena, Wankumbu, Roy, Jerop, Wole, and Ishmael as well. So if we could move on to the next slide, please. Next slide, please. Yeah, so welcome. So this is majorly, what we've been discussing today, and the Youthwise is a youth and women-led project initiated by AIDS Funds in collaboration with networks of young people living with HIV in Malawi and Kenya at the global level by the Global Network of Young People Living with HIV, that is Y+ Global. And so since 2021, Y+ Global has provided technical support to country partners to effectively advocate for adequate and inclusive HIV and SRHI services, products, and resources, and respectful policies and laws. And the partner networks of Youthwise include the National Association of Young People Living with HIV in Malawi, Y+ Malawi, the Network of Young People Living with HIV in Kenya, Y+ Kenya, and the of Women Living with HIV, that is COLH, Ambassador and Adolescent Reproductive Health Program, IREP Kenya. Project. Next slide. Have the next slide. Now here is where everything becomes amazing. So here is you get to express, you get to reflect, and you get to win. So are you passionate about self-care? Of course we all are. We have people in the conversation who've been here for 1 hour and 30. So we are all passionate about self-care. So can you capture self-care journey and practices through art and share your progress with the world? Can you be able to do that? I know I can be able to do that. So we do have a first prize. First place gets 200 euros. First runners up 100 euros, and second runners up 100 euros. I could use that for some sort of enjoyment of the weekend. All right. So next slide, please. Next slide. So about the challenge. The challenge is, Y+ Global in collaboration with Youthwise and Youth Care during the Self-Care Month is launching an online self-care art challenge from June 1st to promote self-care practices among young people, adolescents, and young people aged 18 to 30 who can engage in activities that encourage creative expression and personal reflection, foster love and well-being, and document the process in artistic forms, including but not limited to videos, photos, paintings, and articles. So this is a challenge where you get to win 200 euros or 100 euros based on the content that you create. So do be sure to check the Y+ Global pages for more information about it. The link to get to the self-care challenge is on our website and on our social media pages. So next slide, please. So, with that, thank you so much. That is the catch. You get to create content around self-care, showing yourself, video, arts, paintings. Now, whatever way you can be able to express yourself so that you can get to take home 200 euros or 100 euros and 100 euros for the first, second, and third runners up. So that has been, our conversation today. And, before we leave, I would request most of us now to unmute, or not unmute, but rather have our videos on so that we can have one worldwide global selfie. We need a global selfie, a worldwide selfie. Yes, so I'm just waiting for us all to have our videos on or our cameras on. Yeah, so have your camera on. We're having a worldwide selfie, everyone. Where do you get this? So I don't know. Tim at Global. Do you have it? Do you have it? Do you have it at Global? 1, 2, 3, smile. 1, 2, 3, smile. 1, 2, 3, smile. Everyone, you smile. Amazing smile. Thank you so much. Thank you so much. Oh man, that is amazing. Thank you. Hi, Ivy. So you do have it. I'm seeing smiles from all over the world. Awesome. Thank you so much for taking your time to join us. Do check our social media page for the link to the self-care challenge, and you could walk away with 200 euros or 100 euros. Remember, the rules are simple. Show us your talent and showcase what you can be able to do through art, music, you know, in whichever way you do want to express yourself, you can be able to do that. So until next time, goodbye, Koheri, adios, and obrigada. Thank you so much, and do have yourselves an amazing evening.
Bye, guys. Thank you.
Bye. Thank you so much.
Thank you, everyone.
Thank you. Bye-bye.
Bye.
Bye.
Cute.
Bye.
Soalnya kan aku dulunya